simply assuring them of a risk-free tomorrow.
The good news is that more and more professionals, organizations, and people are preparing to deal with the crisis through the preparation of plans. Apex is India's first and probably the only company to start the risk management industry in India with all the needed expertise, plan, and purpose.
We started analyzing all the prevailing situations of healthcare and conditions of medical professionals around the nation. In a country where we are born with risk-taking abilities, it is really hard to plan for risk management. It was a roller coaster ride for Apex, as majority of professionals at the time were not even ready to visualize that they may land in deep trouble if something wrong happened.
For 20 years, we have, despite a doctor's experience and obvious skill in communication and treatment, the ball gets dropped on the goal line when it comes to a crisis. Apex is the first organized the crisis management party in India and probably will remain the biggest risk management movement of its kind in the world.
The acts and laws were already in force, but since the number of cases against medical professionals were rarely reported, it boosted the confidence amongst the majority of doctors that nothing much is going to happen against them. Insurance by an insurance company, and secondly, God. But we kept fighting because it was in the interest of medical professionals.
From a well-organized planning team, professionally assess the scope of the problem, developing a spontaneous plan, testing the plan, and keeping the plan up to date, we have full expert command on each and every step. It's really a matter of pride and satisfaction that Apex is always ready for its member in any event of a crisis that they may face, whether it is predictable or unimaginable. Our contingency planning is always in place.
Ignorance cannot be taken as bliss, and this fact has to be communicated. We took this on as our prime task and started arranging meetings of small to moderate groups of doctors and hospital owners. We met insurance experts and managers to explore the world of professional indemnity, only to come to the conclusion that it was not at all a complete solution to the ever-growing problems of a doctor. This was the time of deep research and experiments, so that a strong shield of risk management can be created. We went across to a few professionals in the meantime and heard that they had a degree of law apart from their medical degree, a doctor with law, and we restarted our complete risk management plan with a new thought process. Probably this was the solution we were looking for.
We, with our unique expertise, are working in more than 26 states and have a great track record of carrying out some effective crisis management operations in the medical sector. Our efforts and story are instrumental in acquiring the proper risk management teams in many medical associations across the country. Our service offers to cover each and every crisis of a doctor, from professional to personal, and is one of its kind initiative in the world.
This was the time when our efforts to address and resolve legal issues faced by the medical fraternity was in full swing. We saw the scenario of the doctor-patient relationship change very fast. Any death or severe injury pertaining to medical treatment or procedure landed physicians in the court of law, both civil and criminal. We were happy for those who had taken our complete coverage, and for them we stood with full professional expertise and safety.
For Apex and doctors, the bond of priceless services began 20 years before, and over the years, the relationship has continued to deepen. Apex does anything and everything in legal for doctors. We have been solely responsible for all the investments, improvements, and success of AICL. Right now, we have more than 2.5 lakhs active database and working engagements of doctors and hospitals in India. Our increasing client base and net worth show that we have a wonderful future in transforming this business to the next level.
The cases were rising, and so was the confusion amongst those who were completely relying on the professional indemnity of an insurance company. There was this limited coverage policy on one hand, and a number of acts and laws by the government on the other hand. The issues involving doctors were so complicated that the courts needed the practical assistance from the bar to explain the complexities of the procedures undertaken. And we were being proven right. To understand a doctor's complexities requires a very knowledgeable person who should be a learned person both in medicine and the law. Our push for medical legal specialty became an instant hit. From then on to date, we are responsible to bring the best experts in the medical legal field. And ironically, the majority of the actually practicing medical legal experts from different parts of the country are associated with Apex. Our efforts and story were instrumental in acquiring proper risk management teams in many medical associations across the country. Although we never stopped at one solution, we kept reinventing new dimensions. Our service offer to cover each and every crisis of a doctor, from professional to personal, was one such brave initiative. We gave indemnity a new definition and dimension. Insurance cannot help a company avoid crisis, but it can help it avoid some or all of the negative financial consequences. We realized that if worked upon wisely, we can give even an insurance company a good viability. Unfortunately, in those days, insurance officials were just scared of selling with an open mind and were having apprehensions of landing into unnecessary liabilities. By that time, we were a single corporate agent for an insurance company and were selling only one product along with our risk management coverage. We shattered the myth of loss and liability as we sold approximately 15,000 policies with less than 2% of matters arriving in court. And even in that, most of them got rejected by the court due to our effective expert defense.
Every day we change our perspective for the better. Our social responsibility initiative is such a bold and important effort. For years, we are picking underprivileged individuals from rural areas and train them for some important profiles of our team. We enable them to lead and live better despite their circumstances. Most of these individuals are now amazing business builders. In a very true and honest sense, we are really living the idea of Atmanirbhar Bharat or self-reliant India.
We had almost covered the entire North India and had ventured into the South. By this time, we were experiencing many service issues and challenges of our members. It was a great boom time in terms of experience, learning, and earning. Every day, our helplines were getting 10 to 15 service calls, even from those who were not our members. This was a big boost to our initiative. Placing a business of more than 1.5 crore rupees to our primary insurers, selling only one product, was an amazing experience. Chair for the their assurance and safety. Guarantee that we will help our members in anything and everything. There is a feeling our members get when they know their risk managers and experts. They are assured of assistance wherever they go. We are all about your respect. Respect of freeing you from all worries. Respect of making everything easy and convenient for you. Respect of keeping you safe from all the odds and the laws. Apex Insurance Consultant Limited. Original, capable, reasonable. Every medical professional, big or small, has big goals, but they need the right people and protection to achieve them. With more than 50 top globally acclaimed medico-legal professionals, Apex is more competent to secure you for any legal problem. Features, facilities, and claim settlements. Apex has the maximum number of testimonials, appreciation, awards, and recognition that make us the world's leading brand in risk management. From the free consultation to proper record-keeping guidance to free seminars to emergency handlings and media support, Apex is your real professional legal solution. Apex fights anything from professional to personal on your behalf and in any court of law. Apex Insurance Consultant Limited. Safe Doctor. Healthy Society. With Apex, a medical professional is free to take his professional decisions and spend more time growing. We are the first and only in the world to create a complete professional shield of security around medical practitioners. From fighting a case to compensating the patient, we are an expert solution to create a more healthy doctor-patient relationship. Our affordable and reasonable pricing has encouraged more medical practitioners to opt for safe and secure practice. A professionally safe and mentally calm medical professional can deliver more positive and patient-friendly results. We safeguard a doctor or hospital from any eventuality, from the mob to personal attack, to emergency advice, to criminal or consumer cases, to any compensation under any act or law. Our more than 50 medical legal experts and 2,000 legal experts on the pan-India level are doing their best to secure our more than 1 lakh doctor members. We have 99% winning accuracy with maximum number of testimonials, appreciation, awards and recognition that make us the world's leading brand in risk management. Apex Insurance Consultant Limited. Safe Doctor. Healthy Society. Apex made the complete risk management program a reality. Our service towards medical professionals is a testament to our pledge of the Safe Doctor, Healthy Society. With more than 1 lakh doctors and hospitals as our members, we have a great business future ahead with our duty set on our horizons and discovering an innovative way to give medical MSME, Chamber of Commerce and Industry, Award for Excellence in Innovation in Healthcare Industries, 2020. Apex versus competition. They are selling discounts, promises, and a policy. We are selling services, expertise, and solutions. There is a difference. Being a medical practitioner, your needs and challenges are different from those of a common man. You need a customized and effective coverage which comes to your doorstep whenever you need it. Policy, reimbursement, and claim settlement is just not the right stuff to make you completely secure. Apex is the only solution for everything. Simple, cashless, accessible, qualified, reasonable, and guaranteed. And indemnity policy? It comes free with our service coverage. Apex Insurance Consultant Limited. Real protection. Buy an expert care 24-hour risk management guarantee. Doorstep services and complete cashless liability. Buy Apex. An indemnity policy comes to you absolutely free. Apex Insurance Consultant Limited. Complete solution. We are all about your respect. Respect of freeing you from all worries. Respect of making everything easy and convenient for you. Respect of keeping you safe from all the odds and the laws. 24/7 coverage and services to protect you from all cases. India's top experts. 99% cases winning company. Service of your choice. Apex Insurance Consultant Limited. Revolution. Convenience. Service. When you are surrounded by the experts, the world is the safest place. There is a feeling you get when you are served professionally. Add more value to your profession by adding our personalized and expert services. After all, growing your profession won't always be a work full of risk. You have the power to grow your profession, and with us, it is easier than ever. 24/7 expert services, covers all cases, complete cashless, all crisis management, medico-legal classroom training, record-keeping guidance, media trials assistance, MCI appearance. Apex Insurance Consultant Limited. Original, capable, reasonable.
हम आपकी विशेषज्ञता का सम्मान करते हैं। आपका योगदान समाज के लिए उल्लेखनीय है। आपके आगमन का हृदय से आभार। हमारी शुभकामनाएं स्वीकार करें।
Crisis management is not only important but a necessity for everyone. Maybe it is the private sector, for-profit companies, or non-profit. There is always a risk of losing customers' credibility and goodwill. Without risk management and without a plan to accomplish necessary goals, crises grow and relationships are damaged in the long term, short term, or both. And remember, no organization and professional is immune. The future is, of course, here. We live more every day in a global society that is increasingly held together by a complex system of linked and rapid communication.
Year 2000-2001. Modern India was eagerly waiting to shine with many new revolutions in industries, roadways, healthcare, and human well-being. Professionals were busy exploring new heights, but a few sectors like the Indian healthcare system needed some revolutionary changes. More patient-friendly facilities, more attention towards medical professionals willing to contribute through private practice and affordable facilities. The problem was regulating patient-friendly laws, but at the same time, not hurting medical professionals who were involved in ethical practice. However, between all these, it was observed that all this is not going to be smooth sailing.
A lot of unpleasant things can happen to a company, entrepreneurs, and professionals. Unexpected things can always happen, and it may result in a big loss and even in a massive unhappiness. The idea to prepare a professional and an executable plan brought the complete risk management business in India named Apex. The choice to work for the medical fraternity is probably the single profession which has a big communication gap, and there are ever increasing numbers of people who believe that healthcare professionals, especially those who are in a private practice and big corporate hospitals, don't give a damn to them.
More modern treatment and facilities were bringing in more expensive options. But India was not ready for a revolution so soon. There was a need of expert care for healthcare professionals, and so was the hope for an innovative industry in risk management.
Today, anything big or small which have an impact on human or social life, the world media knows about it with a lightning speed. The world learns about the incidents only minutes later. And remember, both the media and the public will be impatiently waiting for accurate information, including explanation for the event immediately. When something goes wrong, no matter who is at fault and regardless of the reasons, someone must tell the story as quickly as possible. The spin in the story which put the organization look good is acceptable, but there should not be the lies and deliberate distortions, because a mistake made deliberately come back to haunt the organization later.
Apex was formed under the Indian Companies Act 1956 with a pure intent and purpose of helping Indian medical professionals, bringing in all the needed revolution for the welfare of mankind without fearing the complications of law and the legal system. It was the toughest choice for Apex because in this country, 90% of the population doesn't know anything about medical complications and effectiveness. And the same quantum of medical professionals are not even ready to open up to new changes.
Risk management is an art, a science, a law, and an expertise which is shaping the finest creative and business movements of the world. There will all places, train wrecks, fires, explosions, negligence, deaths, financial scandals, and a whole bunch of other miserable events that will bring massive unhappiness to the professionals.
There was confusion, but Apex was seeing a bigger picture. The medical industry was bound to grow, and so were the professionals associated with it. It was a clear decision to give medical professionals a big platform to perform, simply assuring them of a risk-free tomorrow.
The good news is that more and more professionals, organizations, and people are preparing to deal with the crisis through the preparation of plans. Apex is India's first and probably the only company to start the risk management industry in India with all the needed expertise, plan, and purpose.
We started analyzing all the prevailing situations of healthcare and conditions of medical professionals around the nation. In a country where we are born with risk-taking abilities, it is really hard to plan for risk management. It was a roller coaster ride for Apex, as majority of professionals at the time were not even ready to visualize that they may land in deep trouble if something wrong happened.
In our 20 years of operation, we have seen that sometimes, despite a doctor's experience and obvious skill in communication and treatment, the ball gets dropped on the goal line when it comes to a crisis. Apex is the first organized effort that brought the crisis management possibility in India, and probably will remain the biggest risk management movement of its kind in the world.
The acts and laws were already in force, but since the number of cases against medical professionals were rarely reported, it boosted the confidence amongst the majority of doctors that nothing much is going to happen against them. There were two main rescuers in their mind: the indemnity insurance by an insurance company, and secondly, God. But we kept fighting because it was in the interest of medical professionals.
From a well-organized planning team to professionally access the scope of the problem to developing a spontaneous plan, testing the plan, and keeping the plan up to date, we have full expert command on each and every step. It's really a matter of pride and satisfaction that Apex is always ready for its member in any event of a crisis that they may face, whether it is predictable or unimaginable. Our contingency planning is always in place.
Ignorance cannot be taken as bliss, and this fact has to be communicated. We took this on as our prime task and started arranging meetings of small to moderate groups of doctors and hospital owners. We met insurance experts and managers to explore the world of professional indemnity, only to come to the conclusion that it was not at all a complete solution to the ever-growing problems of a doctor. This was the time of deep research and experiments, so that a strong shield of risk management can be created. We went across to a few professionals in the meantime and heard that they had a degree of law apart from their medical degree. A doctor with law? And we restarted our complete risk management plan with a new thought process. Probably this was the solution we were looking for.
We, with our unique expertise, are working in more than 26 states and have a great track record of carrying out some effective crisis management operations in the medical sector. Our efforts and story are instrumental in acquiring the proper risk management teams in many medical associations across the country. Our service offers to cover each and every crisis of a doctor, from professional to personal, and is one of its kind initiative in the world.
This was the time when our efforts to address and resolve legal issues faced by the medical fraternity was in full swing. We saw the scenario of the doctor-patient relationship change very fast. Any death or severe injury pertaining to medical treatment or procedure landed physicians in the court of law, both civil and criminal. We were happy for those who had taken our complete coverage, and for them we stood with full professional expertise and safety.
For Apex and doctors, the bond of priceless services began 20 years before, and over the years, the relationship has continued to deepen. Apex does anything and everything in legal for doctors. We have been solely responsible for all the investments, improvements, and success of AIC.
Hello, good evening, everyone.
Very good evening.
Chinmay sir, good evening. Good evening.
Good evening, sir. Good evening. Hello.
Sir, good evening, sir.
Yeah, good evening. Good evening, Baldwin sir.
Good evening, sir. Good evening.
Good evening. Namaskar.
Good evening, sir. Good evening.
शुभुची ना अच्छा आप तुम्हें ये करो ना कहेंगे हाँ सेटा एक कले से आसे तो माने ऐड करिए आपका सस्ता बाजी से
Pratyush sir, 22 doctors are in the waiting list. Should I allow? Can we start?
I think we should start. It's 5:29. 7 o'clock, no?
Yes. Yes.
Dondo.
We can start.
Prithvish sir, you have to start now, no?
Yeah, just a second. Let another 5-10 minutes. Let others join, then we'll start. It is hardly 24. Let us wait for 10 minutes.
Ajit sir, meanwhile you can play some video or something like that. Other the people in waiting room will go away.
प्रत्युष
सर सर नमस्कार.
हाँ नमस्कार शुभुची तो
हाँ हाँ शुभुची.
अच्छा ठीक
ऑल सेट.
मते जेतले आरंभ करिवो यू कॉल मी जस्ट टू
हाँ हाँ मो सर इंट्रोड्यूस कर देके आपन को वेलकम एड्रेस पे कॉल.
हाँ हाँ ठीक ओके
दंड दंड शुभुची ना देखा ना. अच्छा यही समीर एटा मत लागुची ये हेची एटा बोधे म्यूट हेची की हां फंक्शन करछ सर ना फंक्शन करछ जे मागुनी सर.
हाँ यस
शुभुची ना.
हाँ हाँ क्लियरली.
गुड इवनिंग. कला खाली शुणे भूल जाए द्वितीय खपुरे शुणे एवं वक्तृता दिए तृतीय खपुरे निये एवं अनुभव करे कारण बेटे तृतीय खपुरटी श्रेष्ठ एठी गोटे जिंस आसला भगवान राधा को कहते आत्मनिवेदन रो श्रेष्ठ एग्जांपल होते.
नमस्कार.
गुड इवनिंग प्रत्युष.
कोन है जे आपण चश्मा लगौछन कोन
ऑपरेशन है छी कैटरेक्ट
भगवान कहले केबे हला
23rd
राधा जाइके गोबर गोटौछले
ठीक अछि ठीक अछि
जाननथि से गाटा भगवान समर कौशल मैडम गुड इवनिंग.
गुड इवनिंग गुड इवनिंग.
डॉक्टर बेहरा कहउतली कोरोना प्रेसिडेंट कोरोना प्रेसिडेंट
be that and help us.
आउ
Keep helping us.
आपण भलो भलो छंदी
भलो छ
आ चश्मा
आपण कोडे पळेले कोडी ताकू तो देखालानी
नाही 20 तारिख दिन आगुर उठे एक्चुअली प्रोग्राम हमर 20 तारिख दिन मुंडी बाहर को पळैथिली.
अच्छा अच्छा अच्छा
ओके
तांकर टिके अनम्यूट करे दबो. सर को सर लॉगिन करले अनम्यूट कर दो. ରୀତାଞ୍ଜଳି ମ୍ୟାଡାମ ଅଛନ୍ତି କି? ରୀତାଞ୍ଜଳି ମ୍ୟାଡାମ ମ୍ୟାଡାମ ଗୋଟେ ଗୀତଟେ ଗାଆନ୍ତୁ ଷ୍ଟାର୍ଟ କରିବା କଣ
ପ୍ରକାଶ ହେରିକା ଛାଡ଼ିଦେଲେ ପ୍ରକାଶ ଆଉ କିଏ ଏବେ
ବଡ ଗ୍ରୁପ
ଫଟୋ ଏଠି
ତାଙ୍କର ଅନମ୍ୟୁଟ କରିଦେଇଛ ତ
କିଏ
ଆପଣଙ୍କର ଅନମ୍ୟୁଟ ହେଇଯାଇଛି ତ ସେ ବୋଧେ ମ୍ୟୁଟ କାହା କରିନାହାନ୍ତି ମତେ ଲାଗୁଛି ସମସ୍ତ କଥା ନାଇଁ ମ ମ୍ୟୁଟ ଅଛି
ମ୍ୟୁଟ କରନ୍ତୁ ଏବେ
to emergency advice, to criminal or consumer cases, to any compensation under any act or law. Our more than 50 medical legal experts and 2,000 legal experts on the pan-India level are doing their best to secure our more than 1 lakh doctor members. We have 99% winning accuracy with maximum number of testimonials, appreciation, awards and recognition that make us the world's leading brand in risk management. Apex Insurance Consultant Limited, Safe Doctor, Healthy Society.
Well,
Apex made the complete risk management program a reality. Our service towards medical professionals is a testament to our pledge of the Safe Doctor, Healthy Society. With more than 1 lakh doctors and hospitals as our members, we have a great business future ahead. With our duty, service, and add-on offerings, we can multiply this to a great number. We are broadening our horizons and discovering an innovative way to give medical professionals a one-stop solution for every insurance requirement. Our digital transformation plan will bring both patient and health providers under one roof with ease of safe and proper record keeping, high-level communication, and important contact programs. At Apex, we own the future. Apex Insurance Consultant Limited, Safe Doctor, Healthy Society. Most of our 300 team partners from the ordinary background have been transformed to live an extraordinary life through our education, engagement, and support programs. Now they are fantastic business builders too. We are the most powerful and dedicated team with a mission to give its members the best of all services. Our courageous mission to put the lesser privileged people on the road to success is adding new jobs and revenues to local and national economies. Our trained forces are completely focused and are solution-oriented. The leaders of Apex are responsible for building the most robust platform for risk management. Exclusive technically crafted team members of Apex are always ready for the personal assistance of our members anywhere in India. Our team delivers peace of mind, value to your business, and security to your growth. Apex Insurance Consultant Limited, Safe Doctor, Healthy Society. Awards and accolades. More than 100 branches of Indian medical associations and different medical associations recognize us as their official risk management partner. Innovative Zone, most trusted brand to watch in 2019. Business Connect, Consultant of the Year. Business Site, most admired consultant to watch in 2019-2020. India 5000 Best MSME Award, 2019-2020. Consultant Review. Consultant. Right Choice Award for India's Most Promising Risk Management Group 2020. Asia 1, Asia's greatest brands and leaders 2019-2020. Business Side, most valuable brand to watch in 2020. MSME, Chamber of Commerce and Industry, Award for Excellence in Innovation in Healthcare Industries 2020. Apex versus competition. They are selling discounts, promises, and a policy. We are selling services, expertise, and solutions. There is a difference. Being a medical practitioner, your needs and challenges are different from those of a common man. You need a customized and effective coverage which comes to your doorstep whenever you need it. Policy, reimbursement, and claim settlement is just not the right stuff to make you completely secure. Apex is the only solution for everything. Simple, cashless, accessible, qualified, reasonable, and guaranteed. And indemnity policy? It comes free with our service coverage. Apex Insurance Consultant Limited. Real protection. Buy an expert care 24-hour risk management guarantee. Doorstep services and complete cashless liability. Buy Apex. An indemnity policy comes to you absolutely free. Apex Insurance Consultant Limited. Complete solution. We are all about your respect. Respect of freeing you from all worries. Respect of making everything easy and convenient for you. Respect of keeping you safe from odds and the law. 24/7 coverage and services to protect you from all cases. India's top experts. 99% cases winning company. Service of your choice. Apex Insurance Consultant Limited. Revolution. Convenience. Service. When you are surrounded by the experts, the world is the safest place. There is a feeling you get when you are served professionally. Add more value to your profession by adding our personalized and expert services. After all, growing your profession won't always be a work full of risk. You have the power to grow your profession, and with us, it is easier than ever. 24/7 expert services, covers all cases, complete cashless, all crisis management, medico-legal classroom training, record-keeping guidance, media trials assistance, MCI appearance. Apex Insurance Consultant Limited. Original, capable, reasonable.
हम आपकी विशेषज्ञता का सम्मान करते हैं। आपका योगदान समाज के लिए उल्लेखनीय है। आपके आगमन का हृदय से आभार। हमारी शुभकामनाएं स्वीकार करें।
हेलो,
ಮತ್ತೆ ಅನ್ಮ್ಯೂಟ್ करो
अपना सीट कोड बना दो।
Yes, sir. We can start, sir.
Yeah, should we start?
Yes, we can start.
Yeah. Good evening, all. So, as you know, IMA is always dedicated for its member as well as for the society. Today, we have an exciting CME regarding medico-legal aspect, which is the most burning and most important for all the professionals. We are really privileged to have Dr. Mahesh Baldwa. I can say the best medico-legal expert in our country and internationally. He will be delivering the talk regarding all the issues we are facing. So I request everybody to send their queries through chat box so that after the CME, we can discuss those things. That's why I have requested Dr. Mahesh Baldua to restrict his talk within 30 minutes so that we can get more time for discussion. Last but not the least, we are really happy that two of our senior members, Dr. Ritanjali and Dr. Nivedita Pani, both of them have been awarded by National IMA for their persistent effort towards upliftment of the IMA. Congratulations, madam. Hope you will go on and on. Now, I request our president, Dr. Maguni Behra, to deliver his welcome address and call the meeting to order. Dr. Maguni Behra, sir, please.
Tell your grand.
बंद कर दे ये रेल ट्रबल में इनको लेके जाओ
हेलो डॉक्टर मागुनी बेहरा सर प्लीज देखले सर फोटो ना ना ठीक मागुनी बेहरा सर को आगे टिके कलो
हेला मो
सुना रे सर देखले कोन मागुनी बेहरा सर को फोटो छुटे देखले अनुभव कर देता हूं मागुनी बेहरा सर को ठीक कलो Ajit, please unmute Dr. Maguni Behra.
M Behra.
Dr. M. Behra.
Hello.
Yes.
Hello.
Welcome.
Welcome. Hello.
Yes, yes, we do hear.
Hello.
Yes. Yes. You are audible.
Now, acha, okay. Thank you. Let us start the meeting. Thank you, Secretary Pratyush. Let us start. Jai Jagannath. After a long time, am I audible to you all?
Yes, yes.
Very much.
Acha. First thing, I congratulate or I invite all the members to this meeting today. And this meeting, as you know, is in association with Apex, which is an insurance company who will brief us about that. And also, they have selected a very good topic, which will be very useful to all the doctors. It is regarding the medico-legal issues we faced in day-to-day our practice. The problems we will face, medico-legal problems, that will be sorted out by the eminent speaker, Mr. Mahesh Baldua. He is a very good eminent speaker who will solve our medico-legal issues in due course. So I hope all the members will hear from him and will discuss after his talk, as Secretary has already told. So this will be a very interesting topic plus problem solving topic. So we must give our attention to hear from him. Second thing, before I end, I welcome Mr. Mahesh Baldwa, and my beloved members. One thing, in this year, Corona year, everything has been spoiled. We could not able to do any function due to Corona. Anyway, I must give my thanks to our beloved secretary who has made this IMA Bhubneshwar in life. At least every month, 1 or 2 CMEs he's been conducting. It is he is the only person who is making this is possible. Otherwise, we could not have meet even by webinar. So I must congratulate my secretary, Dr. Pratyush. And lastly, I welcome the guest today to deliver the speech. Please continue. Thank you.
Thank you, sir, for your kind words. As you know, just recently we lost one of our very senior member, Dr. Jagannath Mishra sir. So I request our past state president and senior member, Dr. Saroj Sahu sir, to speak a few words regarding Dr. Jagannath Mishra. Dr. Saroj Sahu sir, please.
Before going to the obituary, I welcome Dr. Baldwa, who is not new to Bhubneshwar or not new to this IMA. In 2005, well, I remember, Dr. Baldwa has attended a congregation of doctors in a hotel. By that time, we don't have our IMA house here. The Apex was the only company offering indemnity, professional indemnity to the doctors then. Now, of course, we have many competitors in this field of indemnity to the doctors. However, Dr. Baldwa, as I know, is a good medical legal expert, giving you certain views on the professional indemnity. With this, I congratulate Dr. Baldwa again to Bhubneshwar. Now it is my duty to read out something about Dr. Jagannath Mishra, a senior member of IMA Bhubneshwar. You can see the photograph of Dr. Jagannath Mishra. He was senior orthopedist of Bhubneshwar. He worked quite a long time in different places of Odisha, a long time in Puri and Bhubneshwar, settled at Saileshwar, Bihar. He has passed away only yesterday. IMA Bhubneshwar has felicitated him in the year 2014 on the Doctor's Day for his long time association with the IMA and support to our association. Unfortunately, Dr. Mishra has lost his wife 2 months away. Might be from COVID. And day before yesterday, when he has received the death certificate of his wife, in the next morning, he has passed away to meet her. I, on behalf of the Indian Medical Association Bhubneshwar branch, pay our last homage to Dr. Mishra and pray, Lord, to keep his soul, noble soul, in peace. I request all the members to observe a minute of silence in his favor, to offering a request to the God for his salvation.
Thank you. Om Shanti. Now we have with us one senior advocate and very renowned in Odisha. Advocate Chinmay Patra is also empaneled Apex. I request him to introduce Dr. Mahesh Baldua before the CMA proper. Dr. Chinmay Patra, please. Sorry, Advocate Chinmay Patra, please.
Good evening to all the respected fraternities, medical professionals who are present in this webinar. I'm very thankful to Apex Insurance also for organizing this webinar.
He is muted, I think. Ajit, please. Ajit, please take care.
Hello. Hello.
Yeah.
Am I audible? Yeah.
Yeah, very much.
In today's topic, we are going to discuss about the Apex services highlight and day-to-day problems and issues in medical practice, new Consumer Protection Act and how it relates to medical legal cases, telemedicine's guideline and coverage, and documentation part. Today, we are having with us a renowned doctor and also a medical legal professional named Dr. Mahesh Baldua. He is having 26 years of experience in medical legal and he is also a senior surgeon, a pediatrician. He is expert in drafting legal documents like written statement, rejoinders, written arguments in medical legal cases. He is like an expert of experts in medical legal cases. So all the participants should fully take the chance and try to resolve all the queries that they might be having by asking relevant questions in the chat box, which the concerned Dr. Mahesh Baldua will answer after this webinar is over. One by one, all the queries will be answered by the concerned doctor. Thank you.
Now it's the time for CME proper. Dr. Baldua, sir, please.
Yes, sir.
Okay. Okay.
Good evening, everyone. Am I audible?
Yeah.
Yeah.
Very much.
So we start off. Thank you, the president, secretary, and office bearers. My condolences, Dr. Jagannath Mishra, and two luminaries who got the IMA prize. And as I have been introduced, I was there in 2005 in Bhubneshwar personally, and this is the first time because of the COVID year we are on webinar. Thank you so much for the interest shown in our company, Apex Insurance Consultant Limited, as well as the medical legal talk. Now, These are the books I have written, and as you can see, there is a book by the name of Legal Issues in Medical Practice, which is the highest selling. 7,000 copies have been sold out, and it's still available. Present, as Mr. Chinmay Patra has already told, day-to-day problems in medical practice, new Consumer Protection Act, medical legal aspects of telemedicine and documentation. So, simplified version of medical negligence, antonym is diligence. So, diligently, prudently, with due care and caution, which all of us do. Once upon a time, this was a good definition, but do what is expected and avoid omit doing what is not expected to be done by law. Now, slowly, it has come to become complex, and I would put it as a acronym 4D plus 2F. Medical negligence, 4Ds are duty of care, history, taking history, investigation, diagnosis, treatment, and prognostic outcome, and duty not to breach the point number 1. Damage caused by such breach should be proximate to the duty, and damage if caused, it has to be paid equal to the damage. And no damage, there is no payment. And 2F is a forewarn the patient party as well as about the foreseeable risk. Now, all doctors cannot start blood bank, organ transplant, hospital, mental hospital, MTP, USG, pathological laboratory signing. This you must possibly may be knowing. This slide shows that. Submit documents or otherwise you will be subjected to res ipsa loquitur. So whenever your case is in the court or with police authorities or any of the legal authorities, if you don't submit your documents, medical documents, that IPD, OPD or consent forms, then it will amount to that means the negligence speaks for itself. So res ipsa loquitur is applied by the court. If you don't explain the complication to the court, and court will say the silence speaks louder than what you are keeping silence about, and that is a negligence speaks for itself. And short negligence, these are the examples, 14 examples which are given. The first one, where the anti-malarial medicine was not given in a fever with chills case. Second case, where artery forces were found in cremation ground. Third, where the tip of the suction cannula was left in LSCS. And fourth, where the artery forces was left in the cesarean section. And fifth case, where there is a gangrene which was not explained by Manipal Hospital. The sixth case, where the LSCS caused vaginal fistula, spinal cord operation, where operation table that was there, they did not explain. Eighth case, where the hysterectomy mop was left. And ninth case, where the IV was given, they did not explain how IV caused the gangrene and amputation. PP Ismail case, they lift drill bits while putting the plate and screw in the tibia bone, and they could not explain how the drill bits were broken into the tibia. Then the kidney stone, where the 11th case, where digestant was not removed. And dentist case, 12th case, where the needle which slipped into the throat and pushed into the stomach. The 13th case is about leaving a guide wire in the body of the patient when the fracture of the neck was being repaired or fixed. And last 14th case is the Kagdi versus Dr. Gadge, where the tip of the CVP line, actually they used the feeding tube, which was the first primary mistake. Now the tip broke and remained in the heart, and open heart surgery had to be done to remove it. These are the cases where failure to take X-ray, wrong organ, tying up, keeping the artery force of Gauss piece, and paralysis due to splint, wrong patient, wrong side of the body you operate, too tight a plaster causing gangrene or compartment syndrome, anesthetic mishaps, transfusion mistakes, and removal of wrong organ or wrong digit. Success in practice can be achieved by learning from others. You don't have to commit yourself. Now, work within the limits of your skill and qualification. Otherwise, you may be hanged like this horse. So always it is important to supply your degree and medical degree as well as registration and experience to the court or the police. And that is very important, where that will prevent the allegation of cross-pathy, cross-speciality, or low degree of no degree, and court might label you a quack, not qualified, negligence per se, as you are aware about the, if you don't show the degree which is recognized by the medical council, and fake qualification is as good, that is criminal, and it is like a Monica Bidhi's fake passport criminal case. Now, don't fool patients by MRSH, FRSH, and all other kind of various MD alternative medicine. This is a case where the doctor in MD, she passed her MD in Germany and she wrote it was MD Gynec, and she handled a complicated case of delivery. Both mother and child died, and negligence was found. So many cases giving loud and clear message. Work within your scope of qualifications and skills. Do not hold out to people at large that what you cannot do, because there is a 50% level of passing. So what they in the branch itself, like I'm a pediatrician, I do not know each and everything. So whatever I know, I should be uh, treating. Do not practice and hold out to the people at large what you are not undertaken to study while getting medical qualification. Like in our days, when I passed in 1977, the NICU, PICU, these things were not there. So later on, I learned by my way, but then uh, I cannot say, I cannot compete with whatever the new DM, NICU, PICU people. All qualifications should be medical council recognized. Off-label use should be avoided. You are aware about this Balram Prasad, Kunal Shah's case, famous case, where 1.5 crores were awarded, where they gave 40 milligrams of depomedrol for 40 days, masking sepsis, septicemia, death. Patient was airlifted from Kolkata to Mumbai in Bridge Candy Hospital, and the doctors could not say why they gave such a high dose. This is a higher and longer duration of the amikacin was given 500 milligrams twice a day for 21 days, causing deafness. Lithium poisoning where central pontine melanosis occurred, 100% disability. This is a recent case, 2005, 24-year-old medical student. Lithium was prescribed weak and repeatedly mechanically was prescribed without even bothering whether any psychiatric illness the patient is having. For 6 months, and after that, the patient became disabled with 100% disability with central pontine melanosis. Alleged use of banned drug. This is personally looked after by me, Vijay Lakshmi versus Dr. Krishna Kumar from Jharkhand. The claim of 2.84 crore was put, and the actual cause of liver failure was due to the hepatitis A, falciparum malaria, and typhoid, all three diseases together. It was not because of the nimesulide. We could prove it to the court. Now, off-label use of ciprofloxacin, again, in this case also, though it was given to the 1 year, 6-month-old child, and subsequently at 3 years, there was no problem with the child, so there was no negligence. Always warn and treat adverse drug reactions, and please be aware about severe drug reactions. Treated anaphylaxis, here the streptopenicillin was given, a test dose was given, CPR done, husband joined with the anaphylaxis, and patient died, no negligence. Here delayed diagnosis of Stephen Johnson, there are some MLR, that is sulfadoxine pyrimethamine, was given. The patient was wrongly diagnosed as measles by the pediatrician, subsequently referred to eye surgeon as well as skin specialist, but all of them could not salvage the eyesight of the patient, and then general physician had to pay 50,000, ophthalmologist to pay 2 lakhs, and hospital to pay 2.5 lakhs. Vicarious liability of hospitals, this is very important. These are 5 cases where you should be, if you are running a hospital, you should be aware that the UBM may be, so low platelet count, they did a surgery for round worm, which was uncalled for. Krishna Kumar, state of Tamil Nadu, this is a famous case because we have 1.30 crore, 38 crore, 1 crore 38 lakhs for awarded for not writing on the discharge paper, retinopathy of prematurity and its testing. And Kunal Shah's case already I have described. Savita Garg, where the jaundice occurred, septicemia, gangrene, and amputation of leg and death. Then hospital was responsible. Then MOP was left after postpartum TL, septicemia, and in last case, sepsis due to TL, and again hospital was like vicarious liability of paramedic. Here IV was given by the paramedic to 45-year-old patient, fibroid with endometrial hyperplasia, fractional curettage, and in right arm artery, and gangrene of the arm occurred, referred to Indira Gandhi Medical Institute, where the achial plexus block was given. Then also the amputation, the gangrene occurred in, and amputation at had to be done, and 10 lakhs were awarded. Vicarious responsibility of nurses. You are aware about this case, famous Spring Meadows case, where instead of chloramphenicol IV, chloroquine was given. There was a cardiac respiratory arrest. Instant cardiac resuscitation was done. Child was revived, and he was left with brain damage, mental retardation, and cerebral palsy. Now, 1990s, this is 65 days old baby, which was operated by inguinal hernia, and hot water bag was kept, very hot water bag was kept, and legs were burned, and prolonged treatment, permanent scars and permanent disability occurred. So warmers are better to avoid rather than giving to the small babies on hot water bags. In this is a very peculiar case where, while treating the marginal ulcer of the left eye with carbolic acid, the nurse dropped the entire carbolic acid into the eye, and cornea damage, vision lost. This should not have. Even if you have unqualified and useless staff, then this might happen. Vicarious liability of RMO. If the ENT surgeon epistaxis was treated telephonically by BOMS doctor, and postmortem showed the choking occurred because of the aspiration of blood in the air from nasal bleeding. So again, the doctor was held responsible. 7.5 lakhs were awarded. Here, the treated by enteric fever, discharged, readmitted. There was a perforation due to the enteric fever, and postoperative care was given by unqualified RMOs. Emergency reoperated Apollo Hospital. 5,000 were awarded. Vicarious responsibility of RMO and plus hospital due to deaths of missing of ectopic pregnancy. This is a 2015 case where the OPs were running a nursing home without any proper infrastructure, died due to ectopic pregnancy, which was not realized by the RMOs, and 5 lakhs the doctor to pay 75,000 by the junior doctors. Unhygienic conditions where the maternity patient slipped into the bathroom because of the fungus, and the hospital had to pay 1 lakh. Forewarn the patient if the complications are more. This is a Samira Kohli versus Prabha Mancheka's judgment, where you need to inform about the complications if they are going to occur, have the chance of more than 10%. Inform about the recurrences of the renal stones, hernia, hemorrhoids, fistula. Ask the patient to come after DJ stent or whatever stent you have put for whatever revision. Hernia sepsis causing death. In this particular bowel fistula, sepsis, acute renal failure, dehydration, and malnutrition, and death occurred. In this small child of 2 years, which underwent the simple operation of phimosis, and the patient developed respiratory arrest, and patient was reduced to vegetative state. And this is a recent 2019 case by Supreme Court, 2-judge bench. Phimosis surgery with amputation of penis occurred. Shivkumar John Arthur, 23-year-old phimotic boy. His penis was got after the surgery got infection and got self-amputated, and they did some surgeries and admitted Zipper, but the patient permanently became impotent. Laparoscopic open gallbladder surgery duct due to ileal perforation, and 3 major surgeries were done after the bile duct, right hepatic duct, duodenal perforation, ileal perforation. Referred to CMC Ludhiana for ERCP, MRCP. Corrective surgery was performed at CMC Ludhiana. Sepsis, hypovolemic shock, right pleural effusion sepsis, and septic shock, ARDS, acute kidney failure, multi-organ dysfunctions, and death. 20 lakhs were awarded. Non-toxic thyroid adenoma was being operated by Dr. Kinney, and on the table, patient had cardiac arrest, and he did not join the anesthetic. He continued with the surgery, and in this case, both the surgeon and anesthetist were held liable. Blood product reactions is important in this gallbladder surgery, whether it was performed properly, but ORH negative blood was patient was given B positive blood. No flaws in surgery, but death occurred because of the wrong blood transfusion. 6 lakhs were awarded. There is a 2-judge bench judgment in 2009 of Supreme Court, where against PGI Chandigarh, the wife of the patient was admitted with burns with BRH. Positive blood was given, ARH positive. The patient died after 40 days because of renal failure, and matching the label with the name, sex, and age of group was not done. 2018 emergency surgery for chronic ectopic ruptured pregnancy negligence. held Dr. Kusum Sabrawal as a Sangeeta, where doctors concerned failed to diagnose and consider the possibility of ectopic, and they blindly advise the patient for the pain with antibiotics. And the USG revealed that the right chronic ruptured ectopic pain, the negligence was held. Wrong diagnosis, not disclosing the complication. No USG done post DNC pain in abdomen. This is again Union of India, Rajesh Sharma, where DNC done discharge, wrong diagnosis, abdominal pain, internal bleeding occurred. And just on the basis of suspicion, the incomplete abortion, they continued the treatment and forgot about the ectopic, where the edema, pulmonary edema, DIC occurred and 4 lakhs were awarded. MTP with vesicovaginal fistula, Kiran Sharma versus Dr. Kavita Saluja. Is a known complication, but they did not write on the paper. This is a case where the MTP was done and treated for second surgery somewhere else, where the intestinal perforations were treated. Negligence was held. Incomplete MTP. Doctors could not realize that it is an incomplete and MTP done without prescribed qualification. The hospital was not registered, and even doctor was not registered. LSCS done. The record show the female baby is delivered post delivery, the hypoxic ischemic encephalopathy, and the victim lady is in vegetative condition for past 18 years. And this is again here 18 lakhs were awarded. LSCS without any infrastructure. Dr. Umala Upadhyay versus Anjani Pandey, cesarean was done, and patient bleeding profusely, needing blood transfusion. No blood was given, and not even blood group was known. No oxygen cylinders in the nursing home. Negligence was there. Doing hysterectomy without. So this is the case where Bijoy Sinha, where they in hysterectomy with 7 grams of hemoglobin. Such patient needs ICU care. This was observed by two judge bench of Supreme Court in 2017, and patient went into coma, shifted to SSKM hospital. 5 lakhs were awarded. So you should be careful if the patient is very risky, and pre-operatively you are aware there are a lot of risks and the patient might require ICU care. You should not operate in your small nursing home. 3 different cases of hysterectomy with vesicovaginal fistula and rectovaginal fistula. Here the first case, vesicovaginal fistula was not documented, and second case, rectovaginal fistula was not documented. In third case, the hysterectomy was done, and they failed to document the vesicovaginal fistula. In all 3 cases, for not documenting the case, the complication they were having. Hysterectomy removed ectopic kidney. This is a very peculiar case. Most of the gynecologists, they advise only pelvic sonography, and preoperative full abdomen sonography was never done. Single ectopic unascended horseshoe-shaped kidney, which was removed during the surgery thinking that is adnexal mass. No urine in the postoperative period. Dialysis, later renal transplant was done. So this is a horrible mistake. No records to tight. A plastic gangrene was given for a minor fracture of femur. Here, delayed diagnosis and compartment syndrome infection set in. Patient went into gangrene, amputation along with ARDs. Those survived after septicemia in GMCH, somehow saved 70 lakhs were had to be paid. Status: you have to attend your patient. Law wants care, not the the cure. So here, Dr. Nathan, who is world-renowned epileptologist, and he admitted the patient on Thursday, did not see the patient on Saturday, Friday, Saturday, Sunday, and he could not explain why he did not attend, and patient died. Kernicterus, here the patient jaundice in newborn baby, no pathological tests were done, no phototherapy was given. In this Ayushman Children's Hospital, Jabalpur, where was admitted with 41 milligram of bilirubin, and exchange transfusion were done, but patient became cerebral palsy due to kernicterus. Compensation of 41 lakhs were awarded. Now, IVIM, this is from point of view of general practitioner as well as consultants. Umakant Mane, Rajawadi Hospital, convulsions, patient was given IV. Gangrene occurred fingers, but his right hand were amputated. This is a recent case, 2015 High Court, 21 lakhs were awarded. Wrong IV administration. Shamlal, IV proton was injected instead of Buscopan injection. The patient started trembling, and there was no evidence that doctors were qualified and compensation of 6 lakhs was given. A.M. Matthews, Karuna Hospital, 8.5-year-old child was given fever and tonsillitis intramuscular injection and developed the sciatic nerve palsy. The nurse which had given the injection, they could not show that she was qualified and they had to pay the compensation. More cases of nerve palsy, Rajendra Lal versus Hulda Singh, Anthony versus Gray. That the first case is sciatic nerve palsy and second is palsy. Most common cause for the circumflex nerve palsy in the deltoid is because of the intramuscular injection of diclofenac. Cellulitis and abscess is very common cause. Here the intramuscular injection was given, abscess and gangrene occurred, and necrotizing fasciitis. And if you have the diclofenac injection multi-dose and you keep on drawing from that and injecting. The first case about Philomena, where the acrylonec was multi-dose was used. Here the gas gangrene occurred. Second case, injection in the right arm, necrotizing fasciitis which occurred. Expert, medical expert, proper procedure, no negligence held. Again, the advertisement which we do in the by holdings or in newspaper or maybe on the website, no consent of the patient was obtained, was allegation. Patient did not get rid of the spectacle which was being advertised, that after PRK surgery the patient will not be able to wear the spectacles, and the patient had some number, so the court awarded 1 lakh rupees. 2012 National Commission on Cataract and Ophthalmology. This is again JIPMER. So even the public institutions are not immune from Consumer Protection Act. Complete loss of vision. No antibiotic in any form was administered immediately post surgery. Steroids were started which are very late and they could not explain. Medical boards, both of Rajendra Prasad, that is from Prasad Institute of Ophthalmic Sciences, AIMS, and LV Prasad Institute, both the medical experts say that JIPMER doctors were wrong and they had to pay 5 lakhs rupees. These are 4 consecutive cases of retinopathy of prematurity, which was either not written on the indoor case paper or outdoor case paper. The first case is very recent case, 2018 Supreme Court, where ROP was testing was not documented, 76 lakhs. This was against the second case is as I have already told, 1 crore 38 lakhs against state of Tamil Nadu. Third case is from Maharashtra, and fourth is also from Maharashtra, where ROP testing was not advised. Third case it was 5 lakhs, and fourth case it was 19 lakhs, which was awarded. Double globe perforation before starting the cataract operation, and local anesthesia is given, and double globe perforation causing end of thalamic vitrectomy, and patient became blind. So almost 10 lakhs rupees had to be paid by doctor. Vision lost after the surgery of sinuses, multiple polyps, maxillary sinus. Here the entire eyeball, it coved into the maxillary sinus and patient became blind. And this complication was not explained to the patient and they had to pay 9 lakhs rupees. Pediatric surgery, male child, halothane malignant fever, operated for phimosis, patient died. 2 deaths due to wrong case. The first was a reduction of internal fixation of canal, and second patient surgery, abdominal surgery. Both received nitrous oxide instead of receiving oxygen, and the government of Himachal Pradesh was responded. Operation on tonsil, and there is a permanent vegetative state after tonsillectomy because patient developed the cardiac arrest. Surgeon, without bothering to join the surgeon, completed a tonsillectomy and found negligent. Rubin's test, a simple Rubin's test was done, and patient was reduced to permanent vegetative state because non-supply of oxygen for more than 10 minutes and the cardiac arrest cause they could not explain to the patient. Of course, this was a criminal case, so only 1,000 rupees were awarded, and in default of payment, 1 month simple imprisonment under section 338. Now, tubal ligation, 2 deaths. First case, the patient died, and the second case, the patient became total hypoxic anoxic anesthesia, and the patient is reduced to the permanent vegetative state. Now, pancuronium bromide was injected as a painkiller, and the patient developed respiratory arrest went into hypoxia and ultimately death due to the cardiorespiratory failure. Within minutes, 21 lakhs were awarded. GA was given to the this patient with hernia, and the patient had vomiting during the surgery. The anesthetist did not ask whether the patient has taken something before coming for the surgery, and the aspiration death occurs after 10 hours. No records were supplied. Reception of water were applied. Safe transfer and referral is very important. Delay in arranging ambulance, 3 lakhs were awarded. Here, acute myocardial infarction and non-availability of ambulance vehicle. There was undue delay in reaching. Patient expired on the way, and no medical negligence has been established. Failure to transfer, that was the only thing. And for that, the 3 lakh had to be. Emergency, you cannot refuse the cold patients. You cannot not refuse emergency patient, only you can choose cold patients. Now, these are two famous cases you are aware. There are permanent Katara, where Supreme Court has observed that each and every emergency patient should be treated. In the second case, in the Paschim Bengal Khed Mazdoor Samiti, and third case where you are aware, it was from the Calcutta, where 10,000 rupees were demanded by starting a treatment, patient died. And last case, Savita Guliani, in Orchard Hospital, where the patient died of hemorrhagic shock. As the robbers, they had cut the femoral artery, and they went to the nearest pediatrician, and who referred them to the Orchid Hospital. But both of them did not give any primary aid or first aid to the patient. This is in short the biomedical waste. We are aware about it. Do not mix with the general waste. Disinfect with NaOCl. Collect in color-coded red for anatomical, yellow for solid soil, puncture-proof for needle and sharp, black for general waste. Mark it with label and logo. Weigh and give it for disposal. Those who are certified by your pollution control board. And disposal to the municipal garbage. And otherwise, the marshals can fine you up to 20,000. Anti-Violence Act, which is also there in your states. Now, jail is this is in the COVID. Of course, it is for 6 months, which has already expired. It was hiked, but otherwise, the state act still remains 50,000 of fine. It's cognizable to more than 2 years of punishment, and non-bailable, and penalty twice the amount of the purchase of medical equipment and damaged property. Very important, and you will come to know that omitting of the healthcare from the 2019 COPRA does not mean that you are out of it. There are 3 independent branches as per the Constitution of India, that is executive, legislative branch, and judicial branch. So legislative branch has excluded us, but the legislature have the competence to only under Article 323, and Parliament can make laws, but whatever they omit, that is to be interpreted by the judicial branch under Article 141, and Supreme Court, whatever interpretation is there, that will be final, and executives can give only guidelines. So in this, legislative wing might have omitted, but basically there is a judgment by IMA, which was by IMA versus VP Shanta, which is not repealed. There are 3 judge bench judgments. So now, if you want it to be reviewed, the definition of service under Section 242 includes but does not limit it to. So basically, this is very important, that it is similar to 1986 CPA, and legislative wing might have removed the this thing, but still we are under Consumer Protection Act. And district forum is now district commission, 1 crore, 10 crores for state commission, and beyond 10 crores. So you expect there will be hike into the cases which will be filed against the doctor. So IMA versus VP Salta still remains. This is the Vishwa Bharati judgment, which I showed you earlier, that there is a validity of the Consumer Protection Act, and the Shanta judgment still remains in the force. There is no capping. Medical services free of charge. This is a recent judgment, 2020 judgment. 3 days after the notification of the Consumer Protection Act. It is only where the hospital provides medical services free of charge across the board to all the patients. Then it will be out of the purview of the Consumer Protection Act. Reaffirming Indian medical Association versus VP Shanta. So we are still, this is post COPRA when it is notified on 20th July 2020, and the judgment by Supreme Court, 3-judge bench. Maximum period for disposal of the case is 3 months, as was in the previous this thing. This is again recent judgment, 5-judge bench, and it is very important that the entire process of Consumer Protection Act, whatever cases are filed, should be wound up within 90 days. Patient can file in any territorial juncture, because this was not in the earlier Consumer Protection Act, but in the new COPRA it is there. Patient can take treatment in Patna. Patna patient can take a treatment in Kolkata and file a case in Patna, or Bhubneshwar patient can take treatment at Kolkata and file a case in Bhubneshwar, or wherever he is living. Beyond allegation of negligence, there is one more thing which is being highlighted in the new Consumer Protection is unfair trade practice. Use of pre-printed consent form, Vinod Khanna versus RG Stone, 6 July 2020 judgment, and the National Commission disallowed the pre-printed consent form, but ultimately it was appealed in the Supreme Court, and 18 November 2020 we have received a stay on this. The final hearing is yet to be done. So new causes of deficiency will be passing on the information, confidential information to TPA, third party insurance, Mediclaim, employer. So you have to maintain strict confidentiality, otherwise it will be deficiency of service and unfair trade practice. Provision of filing a case where the patient lives is a new thing in them. Then section 35 to 39, they give the details of how the case will run, and section 48 in State Commission and 59 in National Commission. Only appeals. Previously there was a provision of revision, now review, and now under section 40, 50 and 60, the same court can review the judgment. Previously we had to go to the higher court. The provision for revision petition is removed and replaced by appeals, and you have to deposit 50% of the awarded amount when you appeal. Penalty for non-compliance is stiff now, 25,000, extendable to 1 lakh rupees and 3 years of imprisonment. Any inflated claim in any jurisdiction, a patient can file a case. So how can you leave your practice and go on defending your cases? Now, a new cause of action which is introduced: no cure, no fees. Beware the IVF the centers and hair transplant plastic surgeons. That first offense for these misleading advertisement, or like PRK, your ophthalmologist, that no spectacles you have to wear. Then first offense, it will be 10 lakhs of fine and 2 years of jail, and subsequent it is 50 lakhs fine and 5 years of imprisonment. Rules for new cause of actions are there for restrictive trade practices, and 241 product liability, 83 transfer of cases, which is going to occur because of the change in the pecuniary jurisdiction, and express warranty, and experts will be assisting us. Separate rule for e-commerce, beware those who are registered on Practo, Just Dial, own website, web portal. Separate set of rules are there of the Consumer Protection Act. Now section 66 says there will be experts attached to various commissions. Limitation is the same as 24 months. Only the change is the filing of appeals from the district to state is 45 days. Rest is same, 30 days. Filing of appeal from state to national, national to Supreme Court. Mediation cell is the new creature. Now section 74 to 81 will make their existence, and instead of the normal trial, one can opt for the mediation. Mediation rules are there. Removal of section 22 to 26, that is false and vexatious complaint, in the new Consumer Protection Act. Now take home messages are basically Consumer Protection Act, the hike of from 1 to up to 1 crore for the district, 1 to 10 crores for the state commission, and more than 10 crores for the National Commission. Patient can file the case wherever he lives or works for gain. It has to be decided within 90 days. And section 40, 50 and 60, the review of the order of the same court can be done. Experts will be available under section 66. Limitation under section 69 is 2 years. Revision is removed. Only appeals are by filing, by putting 50% of the amount awarded by the lower court. Mediation is possible, and advertisement, there is a stiff penalty. Medical legal aspects of telemedicine, it is only for the COVID. Normally, we are not allowed. 2 judges bench, that is Martin District of Muhammad Ishfaq, precautions which were, unless there is an emergency, you cannot give advice on telephone. Now, there is a Bombay High Court general where telephone advice was given on phone into LSCS patient which was admitted after discharge the next day, and they said the patient has been given treated telephonically, not personally, so anticipatory bail was not allowed. So there is a contradictory message between the 2009 Supreme Court judgment and Bombay High Court judgment, which is 2018. Delhi High Court in non-COVID patients in telemedicine is allowed. A case filed by Yash Agarwal, Union of India. So contradictory messages are there, but we know that government is very positive about it, and they have their website, and National Telemedicine Network is there, and 70% they live in rural area. We are aware of our population lives in rural area. 90% of the secondary and tertiary centers are in the city. So basically, it will be a boon to us. These are the approved telemed consultation, telediagnosis, teletreatment, teleeducation, teletraining we have been doing, and telemonitoring and telesupport are new things. Telemedicine guidelines, which you are aware, the list O, where on over-the-counter medicine which are available, you can prescribe on telephonically or maybe on the WhatsApp call. List 1, video conferencing is a must, and of course you should be aware the consent you should take from the patient if it's not your old patient. List B is for follow-up consultation. The prohibited list is for psychotropic drugs. Consent and documentation is very important, and it should be as your medical counsel has prescribed: name, age, gender, address, history, diagnosis. You should take consent and document. Audio calls for the old known patient and WhatsApp call consent sent by WhatsApp or email from the patient. Zoom and Google Meet, WhatsApp call video are allowed. Send prescription via email, preferably on your letterhead, and clear cut for how many days you want to give or how many hours you want to give the treatment, or whether he should, if he is a patient of fever, whether he should get the RT-PCR done or not. Documentation is very essential. Position in medical records in 2019 as well as the previous 1986 CPA is one and the same, that 2 years is the limitation period, but medical documents will always remember medical records are not rebuttable evidence in the court of law. Remember, no records, no defense, poor records, poor defense, good records, good defense. Two-judge bench in 2019 have told that considering the nature of the services rendered by medical professional, maintenance of medical record is integral part of the medical services. This is against the non-supply of the medical records is against the fundamental right of the patient. This is 2014 High Court judgment of double bench, and 2020 High Court judgment that they should write the name of the drugs in from your state only in capital letters and good handwriting. Krishna Mandal versus State of Odisha. Now, medical records to be maintained. These are not maintained by Maharaja Agrasen Hospital, Raghunath Raheja, Kanayalal Raman Trivedi and Satyanarayan, Asik Qureshi, Meenakshi Mission Hospital, and Shyam Sundar. And therefore, they were held negligent. Records to be maintained for 3 years. Incomplete record, the income tax part of it 7 years. On the top of each page of IPD paper, you should write the page number. Indoor case sheet should be page numbered. Write the notes in chronological order. Xerox copies to be given to the patient if demanded within 72 hours, and destroy records by giving the one advertisement in vernacular and one in English, and and you can destroy the records of previous to 3 years. Records can be maintained in electronic format, and section 65B allows of Indian Evidence Act allows it. Routine for cold patient, you can maintain your electronic record, except then what is a moribund patient, ICU, ICCU or HDU patient who can develop complications of the drug, surgery or anesthesia, and patient which is transferred and referred to the hospital, other hospital, MLC cases, and like poisoning, burns, fracture, tetanus. And how to destroy record, public notice should be given, and as I told you, one in the vernacular and one in the English paper. Give time limit for what period you want to destroy, and After 1 month, you can destroy the record. Where the litigation is on, pre-litigation and mentally ill patient, please don't destroy to avoid the future troubles. This is the sample of the notice of the Nanavati Hospital. This is the Tata Hospital. Consent and documentation is very important. And 2008 judgment of Samira Kohli versus Dr. Praman Janta still holds true. Real consent is what is required, not informed consent. And what you need to put in part 1, 2, 3, and 4. Part 1, you should write the name, address, mobile number, email. Part 2 should write the procedure, diagnostic or therapeutic, specific procedure, type of anesthesia, local, general, or regional. And part 3, disclose the benefit more than 10% risk of the complications, and alternatives, if they are available, should be disclosed to the patient. Part 4 should contain the doctor's signature as well as the 2 witnesses. Failure to operate within consent limits. This is the judgment where the patient was found to be having taken for the appendix and they removed the gallbladder, which is not allowed. Consent was taken for the clipping of aneurysm, and they found the drill was not working. They abandoned the operation. Patient died of subarachnoid hemorrhage, and this is not allowed. Whatever the infrastructure deficiencies are there, those are not covered in your consent. Now consent is needed for emergency, but you have to document. A negative consent has to be done. Your appendectomy patient, the appendix birth patient died, and the doctor did not take on IPD paper the refusal of the patient, and he was held liable. New challenges ahead, new era of doubts and confusion. There will be cross-specialty practice, whether general medicine doing cardiology or vice versa, pediatrician doing general medicine, GP or vice versa, or general surgeon doing vascular or cardiothoracic surgery or urology or vice versa. Radiologist, pathologist, blood bank, personally doing stem cell, they are doing stem cell therapy, whether they are allowed or not. Officially allowed is 6 months training for USG, or gynecologist doing USG, or MBBS doing USG. MBBS allowed MTP with 20 MTP. Every MBBS can practice on the basis of their experience. Can MBBS sign a path lab? According to 2017 judgment, not allowed. And as per this, and they asked for the review of the same and the clarification. The SC refused to clarify and modify. So now the PG on the MD in pathology can only cite. Then this is a cross specialty case where the MD general medicine who did cardiology, here they held that cardiology practice by MD was allowed. MD pediatric allowed GP, or GP allowed the pediatric practice. We are not very clear about it. MBBS allowed LSCS or appendectomy, or only MD gynec MS surgery is to be. See judgments in the Nizam Institute of Prashant Dhanaka, where the thoracic surgery operated on schwannoma instead of neurosurgeon, and they were held liable and 1 crore was awarded. This is the case where the schwannoma was operated and patient was left paraplegic, and their patient initially by National Commission was paid 15 lakhs, and it was hiked by Supreme Court. So we are still in doubt whether the cross specialty practice is allowed or not. Asking 1 crore will be norm. So be prepared for higher professional indemnity cover. The lowest level will be 1 crore for your indemnity. Patient can file in any territorial jurisdiction wherever he is working or wherever he resides. So AIC will come handy to help you in this situation, because it has 26 state branches and Delhi where head office is there, where there is a National Commission and Supreme Court. Now, not issuing a bill inadvertently also will be unfair practice as per the new Consumer Protection Act. So not providing ambulance also to serious patient will be unfair trade practice. And this is a case 2017 where ALSCS patient developed PPH, and they transferred to another, they wanted to transfer to another institute. They did not provide ambulance, and this was found to be an unfair trade practice. The patient deteriorated and died, and 10 lakhs were awarded. Penalties for misleading, as I told you, are very stiff. Penalties for unfair practice are now hiked, and employing untrained staff or unqualified staff will be unfair trade practice. And in this particular case, Bhupinder Singh versus Jassi Hospital, compensation of 50,000 awarded. New cases of deficiency of service will come. The doctor discloses personal information to TPA. And UTP advertisement on website. Dr. Anjali was the state of Maharashtra, where the advertisement was on the website for a personal website, where the penalty of removal of the name was there, and the patient, the doctor appealed to the High Court, from 3 months, the removal of name was reduced to 18 days. Cases shall be filed in any consumer commission. So only AISL will come handy, because you cannot travel from places to pay for a huge sum of 1 crore, which will become a norm. They can file not only with the Consumer Protection Act, they will go to Medical Council, National Human Rights Commission, Legal Establishment Act, and criminal cases. So then it is physically not possible for a doctor to manage his practice as well as fight the case in various places. So AICL will 26 branches and head office in Delhi will come very handy. Some legal challenges ahead, since there is no capping, as there were capping in New Zealand, Sweden, and USA. Like Kunal Saab would have filed the case in USA also for our why we would not have got 11.5 crores. We would have got maximum 1.5 crores. Mandatory expert opinion, which is now there under Consumer Protection Act 2019, Section 66. Restriction of inflated claim, it should be done. Occurring of complications is neither by negligence nor by deficiency. They are just accidents. It should be realized. Of course, the famous judgments of Ins Malhotra versus Dr. Kripalani and Kusum Sharma versus Batra Hospital, these judgments are there, one should quote. And legal challenges ahead of filing simultaneous cases, which should be used by against Dr. P.B. Desai. You know, P.B. Desai, Praful Desai is one of the renowned oncosurgeon, and his name was removed from Maharashtra Medical Council. And ultimately in 2013, all the cases were quashed and he was found not guilty. Paying interest beyond 90 days should be avoided by quoting the Hilly judgment, which I have showed you, as well as the quoting section 38(7), which is expressly providing that all the cases should be disposed of within 90 days. So thank you, friends, for having patient listening. Now we will go for the question answer session. Thank you, sir. Over to Chinmay Padra, sir. Please take up the questions.
Yes, sir. We have around 5 questions.
Yeah.
From among the 5 questions, 3 questions are put by IMA Bhubneshwar.
Yeah.
And 2 questions are related to some independent doctors.
Yeah.
So I'm just carry on in serial wise. The first question is whether a surgeon doing hysterectomy in a case of negligence.
Basically, this is the entire question, or you want to say?
This is the only question.
Yeah. See, basically what has happened that over the years, I understand earlier the surgeons were doing hysterectomy and cesarean sections in the remote parts, or maybe even in Bhubneshwar and Cuttack also. But in 2020, where by abundance surgeons are available, the gynecologists are available. So if there is hysterectomy, then what would the gynecologist do? This is the first question. So you have to ensure that you may be doing earlier, but today it is not allowed. But okay, now you are done. Then you can only do on the basis of your MBBS, because you have done in MBBS. In the MS surgery, you are not taught to do hysterectomy. You have to then produce the transcript of your MBBS that you did for 1.5 years obstetrics and gynecology. You appeared for the exam, you obtained the marks, and this is the syllabus, and where hysterectomy is allowed. Your MS transcript will never show that hysterectomy is allowed. So you have to do this way. You cannot say that earlier I was doing. Earlier you may be doing because there were less gynecologists. But today in 2020, it will be considered unfair trade practice or a deficiency of service, and as well as it may amount to negligence. Now, Chinmay sir.
Yeah, and now the second question is posed by IMA Bhubneshwar, and the question is: can a sister fill and explain to patient party before sign-in consent?
Yeah, sister can do under your directions. Your responsibility remains with you. If sister fails to explain the complications which are going to occur, or whatever alternative treatment or whatever the type of anesthesia procedure which you are undertaking, and patient alleges that I was not explained, then the responsibility will not be of the nurse or the sister or maybe your ward boy or whatever person you are employing. The responsibility rests with you. And the important thing is that in this recent judgment of RG Stone, where Vinod Khanna versus RG Stone, they have not found any deficiency of service, negligence, or unfair trade practice. They found unfair trade practice of not the pre-printed consent form, but on dotted lines the names were written, the procedure was written, anesthesia was written, and the signatures were done, and they thought that this is unfair trade practice, and one consent form probably cannot cover all the surgeries. So please remember, even though your assistant is explaining, which is allowed, but responsibility that you are the captain of the ship, that is very important, which you should remember.
Now the third question is, if we document complications, be it RVF or VVF during hysterectomy, will it be regarded as negligence?
No, if you have documented and post-operative also you are diagnosed and referred them to the appropriate specialist, then they are not considered. If you want to trick away the patient, that VVF and RVF, you want to wrap it under the carpet and you tell the patient, and patient find then later on diagnosed by someone else that the patient is having VVF or RVF. And in these cases, they were wrapped under the carpet, and that's the reason they were found negligent. But if you have explained that these are the complications, post-operatively you are diagnosed and treated or referred to the specialist, then you are not negligent.
Now
yes, over to Chinmay sir.
Now the fourth question is, in government institutions, are we responsible for vicarious liability? This question is posed by Dr. Ritanjali Mishra.
In the government hospital?
In government institutions, are we responsible for vicarious liability? Government institutions, I mean, it might be government hospital.
See, I have shown you cases against PGI, Chandigarh, JIPMER, AIMS. So the institutes themselves are responsible, and sometimes the judges put that in the judge that Sharma versus PGI Chandigarh, where the clipping of aneurysm was not done by the neurosurgeon. They said the institute will pay and recover from the neurosurgeon, the amount. So they might pass such judgment. So though vicariously the government as well as the government institute is responsible, but they might recover from the professional whatever they have paid to the patient party. Over to Chinmay sir.
Yes. Now the fifth question is regarding telephonic consultation, whether legally allowed.
Actually, in normal conditions, as was the Supreme Court judgment of Martin D'Souza versus Muhammad Ishfaq, where the obiter dicta states that except for emergency, you should not use telephone. But in another judgment which I showed you, that is Dr. Pavaskar's judgment, Bombay High Court 2018, she gave advice on telephone and she did not get the anticipatory bail, saying that patient should have been attended. So there is a contradictory view. But then Yash Agarwal judgment of 2018 allows, that is 2020 judgment, that the Delhi High Court says that in COVID, you are allowed telemedicine practice. Of course, the government is allowing you telemedicine. So basically, there are contradictory messages. But then, according to me, if you even if you do telemedicine, the two things you should not forget. One is taking proper consent, and second, proper documentation. If you have done these two, the telemedicine, according to me, is okay. Over to Chinmay sir.
Yes, the sixth question is, if in OG USG reports are wrong, whether OG specialist will be responsible for wrong treatment?
I don't think the person who is giving the report, he will be responsible. But then the responsibility by the ultrasonologist might be transferred to you, that you should have correlated it with your clinical findings. If obviously, like, you are suspecting, say, ectopic pregnancy, and the sonologist does not report ectopic pregnancy. This happens. My wife is a gynecologist. This happened with us also. The sonologist said everything is normal, patient is not even pregnant. And the patient went into suddenly the shock. And then we realized that possibly the sonologist has missed, and we did emergency laparotomy, and patient was somehow saved. Of course, there was no litigation. But the thing is that primarily, of course, it's the responsibility of sonologist. But secondarily, it is obvious that if you are not able to correlate with your clinical findings, then it might become your responsibility. It will depend upon the facts and circumstances of the case. If you are suspecting ectopic, then you may be. If it is a cold case, possibly you may not be responsible. Chinmay sir.
Yes. The next question is posed by Somen Roy. He asked, is it okay to show or give interoperative pics to patient attendants?
It's absolutely all right as long as you don't disclose the identity of the patient. See, the problem is the identity of the patient should not be disclosed. Once the identity is disclosed, then it no longer remains confidential. So many surgeons, eye surgeons, they are showing on the TV screen. So many laparoscopic surgeons are showing on the TV screens which are in the waiting room. So it is not a problem. You can do recording. But suppose if you are doing some way the identity of the patient is disclosed in that video or audio, then that much you have to either blur the image or remove the audio which is revealing the identity of the patient. The important thing in confidentiality is that disclosure of the identity of the patient. So remember that any part of the video or audio is revealing the identity of the patient, then that is not allowed. Otherwise, the rest of the things are allowed. Over to Chinmay sir.
Yes. The next question is posed by Saroj Sahu. He is asking whether an ID of the patient is required for old consultation.
For old consultation, if you know the patient, there is no problem. But for new patient, always now there are some certain things, situations. If you are
It's
a
not old,
gynecologist,
it's OPD.
OPD patient. Okay, OPD patient or with any patient, ID, Aadhaar card is essential. And now it is more essential. So many times, these out of the wedlock, girls get pregnant, then their 17-year-old girl may look at 18-year-old. But MTP Act does not allow. So you must, my wife insists for, bring your Aadhaar card, birth certificate, or any ID which shows that you are more than 18 years old. See, it is very important. Consent needs to be taken from a competent person. You cannot take from any Tom, Dick, and Harry. So, when it is a less than 18-year-old person, then the consent is taken by parents for any treatment which you are giving to a child or less than 18-year-old. Second thing, Aadhaar card, PAN card, or any identity which fits in your framework, that should be annexed with the consent form. That is very, very important. And it can be done better by email, because email, there is an identification of the person. If it is done by WhatsApp, possibly now with the disappearing messages, etc., or on Google Meet or maybe on the Zoom, it may not be possible to preserve it. So ask the patient to send three things: the consent signed properly with whatever the family members signatures who are attesting it or witnessing it, and Aadhaar, any identity, PAN card, Aadhaar card, or whatever, whosoever the main signatory to the consent form.
Yeah, Saroj Sahu has another question, like, are you allowed to have a CCTV camera in old? I think this is not old. He has mistakenly written as old. It should be OPD and OT. Are you allowed to have a CCTV camera in OPD and OT?
CCTV cameras are not to be allowed where the examination of the private parts of the patients are done. One. Second thing, where the audio, where the name, age, sex is asked. Third thing, see, when anything which reveals the identity of the patient or the female patient, when you need to examine in presence of the female attendant and a female accompanying another female accompanying the patient. So this is, otherwise they might allege molestation or whatever they want to and they can create a mess. So it is very important that the whatever you are doing, OPD or IPD, whatever the identity of patient is important from only record point of view, but CCTV cameras should not reveal the identity of the patient. But in a general waiting area, holding area, you can put for your security reasons the CCTV camera. But OT consultation room, for your own personal purpose, they should you if you want to give it to someone else, then from that you remove that audio and video part which reveals the identity of the patient. If you want to produce in the court of law, it is allowed. If you want to give it to the police, it is allowed. Even the identity, revealing of identity of the patient, it is allowed. Over to Chandmay Patra, sir.
Yes, sir. The next question is also posed by Saroj Sahu, sir. He is asking, what's your view on mixopathy and expectations after the BAMS doctor starts surgery?
I personally, I'm against the mixopathy, but as you are aware, India has 1:1,500 doctor-patient ratio, and most of the doctors are in the urban areas. Compared to rural areas, there is no one. So government has a way to balance this, and that's the reason they are allowing this. But their good intentions are not going to work. This is what I personally feel. And according to me, for me as a medical legal person, it is a boon to me because they are going to make more mistakes and we are going to get more cases. But as a doctor, I personally would not allow mixopathy. The IMA has already challenged, and I am with them. IMA has already challenged in the Supreme Court, as well as they are protesting, and I am with IMA that mixopathy should not be allowed. And I believe they have come out with an act of National Integrated Medicine Commission. So according to me, I think they are going to divert these things to that medical commission. So I very much doubt whether the mixopathy will take its shape. But as on the date, IMA's protest against mixopathy, I am with them and I am against mixopathy. And all these people who are doing MD, Ayurvedic, gynec or surgery or ophthalmology or ENT, they should not be put at par with those who have done MS ENT, MS ophthalmology, MS surgery or MD gynec or MD MS gynec, whatever. So I am against mixopathy personally as a doctor. Yes, Chinmay Patra.
Yeah, he is asking to what extent Apex can fight.
Of course, you can approach them. This does not fall in my domain. I can prepare a good draft. We did it with the RG Stone also, where the pre-printed consent forms are not allowed. Our cases are there, and they are going to hear on 6th of January. And already there is a stay on the judgment of National Commission, which was passed on 6th of July 2020, that pre-printed consent forms are not allowed. We were supported by IMA Punjab, IMA Haridwar, and IMA Delhi. And we have filed the case and we are fighting it. So if IMA Bhubneshwar thinks that you should fight for it, you can approach Apex Insurance and they will fight for you. There is no problem. Over to Chinmay, sir.
Yeah. The next question is raised by Ritanjali Mishra. The question is, sometimes patient is not coming to OPD. Only relatives are coming to take medicine, specifically for bleeding cases. Should we give medicine?
According to me, there are three situations I will. It's an old patient which you are aware with. Patient is also very old and everything is old and known to you. So it's you think that you are aware about a diagnosis you can give. But it's a young patient. It could be an ectopic pregnancy. It could be incomplete abortion. And you should not give to such a patient. And third situation could be that the bleeding, earlier there was no bleeding to an old patient and it is a fresh bleeding case. Then you should be again insisting on seeing the patient, you should not be giving. So there are three different issues: young patient, old patient, and absolutely new patient who was not having earlier bleeding history. Yes, over to Chinmay sir.
Yes, the next question is raised by Somen Roy. He is asking for teleconsultation. What should be the appropriate prescription format? What app, WhatsApp or email?
No, actually the consent and documentation should be on the email, and you can make an audio video call on Zoom, Google Meet or WhatsApp, whatever you want. But the consent and documentation, that is the prescription. Then prescription will have 4 parts, as I told you: the name, age, sex, whatever, the gender, or their identity of the patient, which is the very important. Then what is the current illness, what is the past history, and then you write the prescription, which is as per the guidelines given, that over-the-counter medicine, or it falls in A or B, or whatever the types of drugs, it's the follow-up or the first fresh consultation. And lastly, you put the signature and on your letterhead. So according to me, I am doing it, and I am doing on email. So my document remains on email, that I given this prescription, and the patient's consent remains on the email, that he gave me the consent, as well as he produced the documents of his identity, that is Aadhaar card, PAN card, or whatever identity which he wants to give it to me. Now over to Chinmay sir.
Yes. The next question is raised by Kajal Rakshit. She is asking, is bridge course legal?
Oh, yes, it is legal, but then according to me, IMA should fight for it, the National Medical Commission Bill. But then there are 2 judgments, which of course was not a part of this, one from Karnataka and one from the Uttar Pradesh, where they have gone, these Ayurvedic people have gone for a bridge course, and it was declined by the High Court of Uttar Pradesh as well as Karnataka. So basically, as far as the legal position is concerned, they are yet not been allowed. In fact, in one of the UP cases, for the community health worker, they preferred nurses as compared to these homeopathic and Ayurvedic doctors. So that is another surprising thing. They gave an advertisement for filling up community health workers, and they have chosen only nurses. So it gives a loud and clear message that the doctors and homeopathy and Ayurvedic people will not be preferred. As far as judiciary's position is concerned, the states which allow under Drugs and Cosmetic Act, Section 2, subsection 3 and subsection 2 EE, where there is the dearth of doctors and they can prescribe allopathy, okay. But the new bridge course, according to me, so far is not allowed by the judiciary, though it is allowed by the act. Thank you. And Chinmay sir, over to you.
Yes, this is the last question raised by Saroj sir. He is asking, do the Apex will provide indemnity to BAMS people?
No, this question, I think
It's a BMS, sir. It's a BMS.
BMS, of course, we are providing to BMS. There is no problem. See, sir, as far as medical legal is concerned, I provide to everyone. As far as Chinmay Patra sir is concerned, he provides to everyone. There is no ban on it. But as far as the IMA is concerned, as an IMA member, I am allergic to whatever the proposition which you are telling. So I will not support them mexopathy, or they are practicing allopathy, or they are joining the bandwagon of allopathy. I would not prefer as a doctor. But I think as a medical legal, we provide them the services because from where we are getting reinsurance, they are also giving to BMS, BHMS, and Siddha, Ayurvedic, and everyone. So we are providing all the services. And I think Advocate Chinmay Patra will also give them services if asked to do.
Yes, sir. Why
okay. So there is of course, a contradictory message here. As a doctor, I don't support all this, but as a medical legal, I have to support because it is being supported by the law.
Excuse me. Yeah. So I think as this is really a burning topic, so if we continue, so this is not going to stop. So the email ID and WhatsApp number of Dr. Baldua sir is there. So anybody wants, they can contact him personally for their problems. So I think this is time we should conclude. I request anybody from Apex if they want to speak something. Any Apex people?
Yeah, Pratyush, can I be?
Just a minute, sir. I will give you vote of thanks time. Just a minute.
Yeah,
This is time for Apex people. Jitendra Panda sir, please. You will be giving vote of thanks. So
okay.
This is time for Apex people. If anybody wants to speak anything from Apex regarding their company. Ajit, anybody from Apex?
No, Pratyush sir, we'll continue because we don't have that much time. According to the schedule, we are running beyond the schedule.
Ajit, you can highlight regarding your company.
Achha. Yeah. Hello.
Yes.
What's the coverage, etc.? You can just highlight.
Hello.
Yes, hello? Ajit, you are audible. Please go on.
Yes, sir. So, first of all, thank to IMA Bhubneshwar, especially to Dr. Pratyush sir and all the office bearers. And as you know, doctors, we are a company running for the last 20 years, and we are protecting and working for the doctors, and we cover all the legal issues, whether it is filed in any court of India. So from day first, we are responsible for all the legal help, and as you have seen in our videos also, and Apex will bear all the legal expenses and pay the compensation if court says, and we are completely cashless. So we need your support. We need the blessings of IMAs, and we are a recognized company. So thanks again. And if any of the doctor members, if they have any queries related to Apex, they can write their numbers. We'll send our executive or officials to visit them personally. So thanks again to all the participants. Thank you very much.
Yeah, now this is time for vote of thanks. I request Dr. Jitendra Panda, our Vice President, to deliver the vote of thanks. Dr. Jitendra Panda, please.
Thank you. Thank you, Pratyush. Thank you, Pratyush, for giving me this opportunity. I can remember Dr. Bhalva 15 years ago when he came to Pushpak Hotel in Rajmahal Square, and that was the first visit to Bhubneshwar IMA. We didn't have the IMA hall, as Sarosa already told, and since then I have been a member of this Apex Insurance Company Limited, and I've been greatly benefited by the insurance cover, indemnity cover over last 15 years. And I think Dr. Chinmay Patra, Mr. Chinmay Patra also would remember me, because he also he stood for me in the local consumer court. Mr.
Yes,
Patra.
sir, I remember. Yes. I have not forgotten you. I remember.
Thank you, both of you. Thank you, both of you, Dr. Bhalva. You spoke wonderfully well, and you cleared our doubts, but you spoke so fast that it's a bit difficult to grasp, and we'll be forced to buy your book, that medical legal book. Although many questions were put to you, and you have cleared very well indeed from the minds of our IMA members. And I can say that one thing, that your qualifications are probably unique in our country. Having a basic pediatrician, you have gone to the law and done a PhD and PhD in law, which Dr. Sharo Sao has already highlighted in the beginning of his introduction. And I must thank you, Dr. Bhalwa, to come again to our IMA meeting virtually. Thank you so much indeed. And Mr. Chinmay Patra also doing a very good moderation and taking all the questions patiently to clear our doubts. I must thank all our members who have taken part in this meeting tonight. And but most of all, I'll thank our Secretary, Pratish Roy, President Maguni Behra, and of course, Saros Sau for arranging the meeting for the benefit of all of the IMA members. Thank you so much. I hope we will meet again and look forward to such meeting once again.
Thank you, sir.
It will be available. Thank you, Patias. That's the end of my talk. Word of thanks.
Thank you, sir. So we can conclude. Everybody can log out, please.
Thank you.
Yeah. Oh, बढ़िया हाला समीर, excellent. First class हाला. हाँ, मुझे तो लीव मार दीजिए. ओ, हाँ, सुबह.
Shall I close, sir? Shall I close?